Come in.
Hi, I'm Sherry, and I'm going to be your medical assistant today. Dr. Bird has asked me to give you an MMR immunization. Is that okay?
Sure. What's an MMR?
MMR is for measles, mumps, and rubella, and it looks like your titer that you had drawn showed that you did not show immunity to one of those three, the measles, mumps, or the rubella. What will happen is this will be a series of 2 injections. You will get one today, and then next month you'll come back and we'll administer the other one. Is that okay?
Yes.
Alrighty. You're not going on vacation, some long-term trip somewhere that you won't be able to come back, are you?
No.
Alrighty. So what we're first going to do is I'm going to give you the MMR vaccine information sheet. If you will read over this, and if you have any questions, I'll be happy to answer those for you.
Okay, thank you.
Okay. An MMR is actually a reconstituted medication, and we did the reconstitution with that earlier. Once we pull medication from the refrigerator or the storage center, we always do our first check at that time. So we did that when we pulled it from the refrigerator. I'm doing my second check before I draw this up. So I'm checking my order to my vial. Okay. Alrighty, that's my second check. I'm going to now, before I draw up my medication, I'm going to ask my patient if she has any questions.
No.
No, okay. Alrighty. Just make sure that you do follow the instructions that are on the back. So if you have any problems, a fever, sometimes we get a few aches and pains, tenderness at the injection site, we want to make sure that you take Advil, Tylenol, whatever it is that you have at home as prescribed. Which do you normally use?
Tylenol.
Okay, alrighty. All right, so before we get started, I want to make sure that I review the vaccine consent form. So we are going to be given the MMR, and in which I will, at that point in time, I need to make sure I write the VIS date on the MMR line. Okay. Have you been sick or experienced a high fever recently?
No.
Okay. Do you have any allergies to medications, food, vaccine components, or latex?
No.
Okay. Have you had a serious reaction to vaccines in the past?
No.
Okay. Have you had any problems with your health, with your lungs, heart, kidneys, or metabolic diseases such as diabetes, asthma, or any blood disorders?
No.
And are you on any long-term aspirin therapy?
No.
Okay. Have you, a sibling or a parent, had a seizure or have a child who has a brain or other nervous system disorders?
No.
Okay. Do you have cancer, leukemia, HIV, or AIDS, or any other immune system problems?
No.
Okay. In the last 3 months, have you taken any medication that would weaken your immune system, such as prednisone, cortisone, any other steroids, any anti-cancer drugs, or have had any radiation therapy?
No.
Okay. In the past year, have you received any transfusions of blood or blood products, or been given any immune gamma globulins or antiviral medication?
No.
Okay. Are you pregnant?
No.
No. Okay. Can you state when your last period was?
I had a hysterectomy in '87.
Okay, thank you. And have you received any vaccines within the last 4 weeks?
No.
All righty. And are you okay with receiving the MMR vaccine?
Yes.
All righty. If you would, please go ahead and sign for me there.
Okay.
This is getting a signed consent from the patient that it is okay to administer the medication or vaccine in this instance. You will need to make sure that you have a vaccine record based off the patient's age. You will also need to make sure that you have your progress note. All right. Now this is a subcutaneous injection, so is it okay to use your left arm?
Yes. Yes.
Okay, if you would go ahead and roll your sleeve up for me. Now that I've already checked it once when I pulled the medication out, I've checked it a second time after I've been in the room and she gave consent. The patient has signed consent, and I'm going to make my third check before I draw my medication up. And it is correct. And I did wash my hands before entering the room. Because I'm going to be using this part of her arm, I'm going to move my supplies to the other side. When we look for the subcutaneous part of the arm, we're looking for what we like to call the chicken wing, so the fatty tissue part back here. Okay, if you just go ahead and relax your arm for me. And right in here is where I'm looking at. And again, I'm doing a concentric circle. And for demonstration purposes, I will be drawing up this vaccine. I'm checking my needle to make sure there's no burr. The lumen or the hole in the needle is open with one hand. Again, a vial, you need to give it air to receive anything. I'm going to turn it over and I'm going to draw up 0.5 ml. I will have a 2x2 gauze in my hand, and this is going to go at a 45-degree angle. I will pinch her arm. Okay, are you ready?
Yes.
Okay, on the count of 3, little poke. 1, 2, 3, poke. I will aspirate, so I'm pulling down. Make sure there's no blood, and then I'm going to inject slowly. Remove the needle. Activate my safety and apply pressure and massage. I drop my needle into the sharps container. Okay. Do you have any allergies to adhesives?
No.
Okay. Because I've given you a vaccination, I will need for you to wait for 20 minutes. And I do know that you need to, when you check out, you need to schedule another appointment. It is 4:22, so if you'll go ahead and check out, and there's a seat up front. So just stay there, and then I'll come out in 20 minutes, and then at that same time, go ahead and schedule your 1-month follow-up for your next MMR.
Okay.
Okay, thank you.
Thank you.